Hello, my name is Wojciech Peter, and this is my colleague and first shared author, Ivan Zahradka, and we will briefly summarize our Annals of Internal Medicine article. The investigation took place at the Institute for Clinical and Experimental Medicine in Prague, Czech Republic. It was supervised by Professor Vyklický, and statistics was handled by our biostatistician, Dr. István Módos. Kidney transplant recipients were not included in COVID vaccination randomized controlled trials, and for many of us working with transplanted patients, it was unclear how much or even whether we were helping our patients by vaccinating them. To answer these questions, we conducted a retrospective cohort study and observed an association between vaccination and lower rates of COVID-19 infections, although perhaps the observed effectiveness was lower than originally hoped for.
Our transplanted patients were hit especially hard by the COVID-19 pandemic, with high rates of COVID-related mortality. And when we realized that we might be holding data that are very valuable for the whole medical community, we decided to pursue the analysis further. First of all, the Czech Republic has been hit severely by COVID. During some periods of the pandemic, we had the highest rates of cases and mortality in the world. And this means that a lot of patients were exposed to the virus and a lot of patients got sick. Secondly, our transplant center, the Institute for Clinical and Experimental Medicine, has a large transplant program that cares for more than 2,500 kidney transplant recipients. And we believe that we were very successful in a fast vaccination rollout to these patients early on. Lastly, we consider our data to be very reliable. This is mainly due to the National Registry for Infectious Disease, where all cases of COVID in the country are mandatorily reported and all vaccination provided to the patients as well. Especially the role of the National Registry cannot be overrated, since without it we would have missed a lot of the cases and the data would not be trustworthy. And when all these factors come together, you can perform these kinds of analyses.
Our results, although encouraging, describe vaccine effectiveness during the study period. That is, during a time where the Alpha variant was dominant. Also, although we applied a wide range of statistical approaches, including the background risk adjustment, the observational data cannot replace a well-designed randomized controlled trials, which, however, are currently not available and might not even be feasible. Unfortunately, the COVID pandemic is rapidly evolving and the situation is ever-changing. For example, it is unknown to what degree the current mRNA vaccines will protect kidney transplant recipients against novel virus variants and what should be the optimal strategy regarding additional booster doses. Even though it seems that kidney transplant recipients are a small, marginal group, the numbers of solid organ transplant recipients are increasing in the developed world. And we believe that our study results will be of interest to a broader audience than just the transplant community. We are also provided with a professional peer review process that really helped to shape the article, and for this we are grateful to the whole editorial team.